Okay. So which of the following additional laboratory findings is most likely to be observed in this patient? So read the point, iron transferrin, iron binding. Okay. So a 28-year-old female presents to her primary care physician with complaints of fatigue, weakness, pallor. She reports heavy menstrual periods, low iron rich foods, pale, nails are brittle, low ferritin, hemoglobin. Which of the following additional laboratory finds is most likely observed in this patient? Obviously, this person has an iron deficiency. I mean, heavy menstrual bleeding means you're gonna lose iron. She does, and then it was even more helpful and tells you she has a low iron rich diet or
Mhm.
food. So it's gonna be an iron deficiency related issue. So it's
Okay.
just kind of knowing that path and then knowing what increases and what decreases between the different variables. So let me see if let's see, normal total capacity, let's see, increase erythropoietin. Mm, I don't know, I could see if I see anything else that sticks out more. Um, increase serum iron. No, that would definitely, that's wrong. That should be low. As far as increased transferrin saturation, I'm trying to, so like usually in iron, the iron goes down, but the TIBC goes up. But I'm trying to remember if the TIBC is the same as, that's the transferrin binding capacity. Is that the same as transferrin saturation? Let's see, increase unsaturated. Uh, so now I'm running low. Let's see. Total iron, normal total iron binding capacity. I don't think that's right either.
So
So
far, I like what you're talking about here. You already have your diagnosis, right?
yeah, I have my diagnosis. I'm just trying to break down the answer choices.
Yep. Okay. So talk to me. So talk to me. Let's just keep it real simple. You said the TIBC, right?
TIBC should be increased, and I'm
Okay,
just
good.
trying to see the relationship. So that's the transfer and binding capacity, and I'm trying to see if the relation. Well, there's an iron, but they give you an unsaturated iron binding capacity, increase unsaturated, and then it gives you a transfer in saturation. Well, they both have binding capacity, but I'm just making sure unsaturated is meaning the same thing as TIBC. And so that's what I'm trying to think about.
Okay, so you're between these two, correct?
Yes.
Okay. So talk to me, right? Like, what does your gut say? Give me your gut answer choice. If I were to tell you I need an answer choice in 2 seconds, which one did you give me?
Probably D.
Okay, good. Okay, so that's your gut answer choice. Now the question is, right? That's how I want you to think about these questions. If you had to choose right here and now, what would it be? So you said D, that's your gut answer choice. Now the question is, do you have evidence to change this? Yes or no? Do you want to change it to C? Do you have concrete evidence to change it to C?
Um, transfer and saturation. I'm trying to understand what that's implying, and I can't even
Okay,
apply.
if you can't understand kind of what it's trying to say, then you can't change it, right? Because if you were to change it, you would have to give me good evidence, right, of why you change it. You get what I'm trying to say?
Yeah.
So so in a test taking situation, I would say you got to stick with D. Does it make sense?
Yeah.
And D is the correct answer. You understand what I'm saying? Because it's transfer. The TIBC is the same as this iron binding capacity, right? But the thing is, unsaturated, that makes sense because if you don't have any iron, then it's going to be not as saturated. Because remember, these things are just proteins carrying around iron, right? So if you have a lack of iron, then of course it cannot be saturated. It's unsaturated, meaning it's not carrying any around. It's trying to scavenge and get some around, but you're going to be missing them. Does it make sense?
Yeah. Yeah. But see, yeah, that kind of question I would be between C, D, and possibly A, and then I'd sit on and then like try to like make sense of A and C to be for sure a D. So I think that with the testing strategy, what you're saying is like your gut is saying D, but if you don't have evidence for A and C, stick with what you got because you can't change it, right?
Yeah, no, for sure. Like, I mean, my thing is always you gotta like you have to pick a gut answer choice because think of it like this, right? If you sit here between three answer choices and you just sit here, right? And you don't commit to anything, right? Like you're not saying, hey, what does my gut say? And students always ask me, what is a gut answer choice anyways? What does that even mean? Okay, my explanation for a gut answer choice is that you've done all this studying, right? The information I know for a fact is in your brain. Okay, whether you're able to pull it out to the forefront of your brain during the time that you're reading a question, that depends on the time, that depends on the date, and that depends on how far removed that you last saw that material, right? Your gut answer choice is your subconscious saying, hey, this is the answer, right? Like, I can't tell you exactly why that's the answer, but like you've done all this studying, it's in the back of your mind somewhere. And so your mind is telling you, hey, D, right? But you're like, man, I just can't put my finger on it. I can't tell you exactly why it's D. I just have this feeling. And so that's why I always say that's your gut answer choice. So I always say, unless you remember something significant where you're like, oh, that cannot be right, let me change it, you got to stick with your gut. It's going to more times than not be the right answer. So